As a doctor, I realise how important it is to really understand the experience of your patients. If you don't understand their experience, as well as their clinical outcome, you're not going to really understand their whole journey.
Trying to improve the patient experience is a really difficult thing to do, and I think that unless you drill down to the local level to understand what patients are telling you at each ward level and each service level, you can't improve your service. And working with iWantGreatCare, we were able to develop a format that is actually really easy for our patients and our staff to use.
The aim of iWantGreatCare is very simple. It's to capture patient experience in a really easy, simple way, but then to use that information to drive up the quality of care.
People have become a lot more empowered as consumers in most aspects of life. And people don't really think of themselves as consumers as yet when it comes to healthcare. But my sense is that healthcare can't stand outside of the new rules of the new normal. And the new normal is you get asked for your views because we live in a world where people are pretty informed and inquiring. And I think healthcare is coming to terms with that.
It should be as easy to review your GP, your hospital, as it is to review a hotel or a washing machine. And if we get that right and do it in a transparent way, the quality of care will increase.
Working with iWantGreatCare has been really successful. They have provided us with the data that underpins a lot of other pieces of work that we wouldn't have been able to get without a great deal of effort in the organisation. Every patient that comes in is offered the opportunity to complete a form, and either they and their family can complete it before they leave. All of those forms are then collated, posted off to iWantGreatCare, and about a week later you get your results back. So it's very easy to manage.
In outpatients, we give cards to all patients and ask them to fill a feedback form either online or in the computer we set up there. And we've got an iPad to see if that's another easier way to systematise it and capture feedback comments. It's all anonymous and it only takes a minute.
I think having real-time feedback is valuable. People can't hide away from it and say, oh, that was 6 months ago and we've improved. So people have to acknowledge that it's their feedback, it's their local feedback, and they need to do something about it and understand why the patients were reporting that experience. So it enables the clinicians, particularly the ward sisters at a local level, to address the issues that are highlighted in a timely fashion and when people will probably remember what the reason was.
Over the last 2 years, it's really changed the conversation in the department. We're much more focused on patients. We're trying to improve the service we deliver, and we're understanding more about how it impacts on patients. So it really has changed the way we work.
I'd recommend this way of working for a number of reasons. Firstly, we get the real-time feedback, which is absolutely vital in terms of improving services. But secondly, because all the stress of data collection is taken away from us, and then the results are emailed back to me 3 or 4 days later. What I have is a set of data that I can see at a glance. I don't have to wade my way through 20 pages of written information, and I can share it with the teams very, very quickly, and they find that really useful.
Getting feedback is a very personal thing. I find 98% is positive, and so that's really, really nice because they're referring to things I've said or done for them. I think also that negative comments are important because if patients had a negative experience, we want to make the service better, and that's why I believe iWantGreatCare is important.
Our plan is to roll this programme out across all of our services. So currently we just do the inpatient wards, but we plan to roll it out across the rest of the A&E department, outpatients departments, therapies, and then into the community with the district nursing teams, the health visitors, podiatrists and all of the teams. And we have an ambition to allow every patient who comes into contact with our service the opportunity to rate us on a regular basis.
When you look at the calculations, it would be easy for the NHS to be spending tens of millions of pounds to answer one question, the friends and family test. One of my real objectives here is to provide a service that saves the NHS tens of millions of pounds, money that should be spent on frontline clinical care, but also captures that question in a really robust way. If we want patients to provide honest, robust feedback and information, they have to be absolutely sure that the hospital won't use it in any way that might concern the patient. Having independent structures to collect the information, to analyse it, totally reassures patients. The other thing, of course, is that iWantGreatCare is essentially a clinically led organisation. As a doctor myself and other colleagues and the members of the board, we all come from a healthcare background and an NHS background and really understand these sensitivities, both from the organisation side, the doctor side, and perhaps most importantly, from the patient side.
Our experience working with iWantGreatCare has been nothing but positive. We've seen our national survey scores move into the middle 60%, where historically they've always been in the bottom 20%. We now have a reported family and friends test score of the high 60s to mid 70s, which puts us in the top third of the country.
We're seeing a changed relationship between patients and the public and the healthcare system and the NHS. The friends and family tests, the solutions that iWantGreatCare put in place, allowing anybody to rate and review their doctor or their hospital, are a sign of those changing relationships.
Healthcare in this country, just like everywhere else, it's joining the rest of the world. It's, in a sense, it's catching up with other industries where the use of IT, the empowerment of consumers, the availability of choice has become the new normal, and that is beginning to happen in the NHS, and I think will accelerate in the years to come.
We're seeing patients' trust and confidence in their local care providers go up, and I think we're only at the beginning of that journey. I think in 5 or 10 years' time we'll look back and wonder how we ever imagined we could run the NHS without a friends and family test, without real-time feedback.